Well, an urgent warning today from the U.S. Surgeon General about social media and its impact on kids' mental health.
In an advisory that was released just this morning, Dr. Vivek Murthy says social media is driving a mental health crisis among adolescents. According to the Surgeon General, sites like TikTok and Instagram present a profound risk of harm for kids. The advisory cited several studies that found correlations between social media use and depression, anxiety, poor sleep, online harassment, and low self-esteem.
This is a real point of concern here. When nearly half of kids are telling us that social media use makes them feel worse.
Dr. Murthy is calling for more research on this subject into the impact of social media. He's also calling on policymakers and tech companies to take action. The White House is mobilizing an interagency task force to identify current and emerging risks. We're going to continue the discussion on this today with Dr. Jeff Potoff.
In addition to being the Chief Quality Officer at UW Health, Dr. Potoff is a father of 2 preteen girls.
Yeah.
Welcome. Congratulations.
You bet.
There seems to be, I mean, this has been around for quite some time now. There seems to be new urgency over this. Why do you think that is?
Yeah, I think there's more and more studies coming out showing just how dangerous social media can be, especially for younger children, you know, age maybe 6, 7, up to 16, 17. And I think a lot of parents maybe underappreciate the risk that it can have to their children. If you want to know what doctors talk about when they get together, we talk about our kids' social media, how do you handle that conversation, realizing that there's risk with depression and even suicide with social media use.
The statistics that came out today are pretty terrifying. It showed that 95% of teenagers are on social media. Children ages 8 to 12 are also using it, and the average amount of time a kid spends on social media is 3 hours. And if you spend that long, the Surgeon General says you are more than 3 times at risk for anxiety and depression.
Absolutely. I think the thing that's concerning is I think as parents we worry about our kids getting into alcohol, drugs, things like that that can addict you. When we do studies and we look at the centers of the brain that light up when folks do alcohol and drugs, the same centers light up when our kids are on social media. So it's not like our kids can just put this down once they're using it that much. They're legitimately addicted to it. And then you have all these like bad health outcomes where, you know, depression, anxiety, loss of sleep. It's concerning.
Put on your dad hat. How do you deal with your girls?
Well, so I think it's tricky. So my dad hat is a lot of my oldest daughter's friends do have phones. They are on social media. I don't want her to be ostracized because she's the only person that doesn't have it. At the same time, worried about, you know, if she had access to those platforms, what would happen. So we've tried to take a middle ground where she has access to phone and text, but, you know, not a camera and not these other apps. And we'll probably continue to try to do that as long as we can, just because I worry about, you know, what if she becomes one of those folks that is this statistic.
She's wearing a watch.
Yep.
So that
It
limits the time you're going to do that. You're not going to sit there for hours typing on your watch.
Right, and you can't take pictures and send things. And so it provides some of that, you know, social connectedness she wants to have with her friends and makes it a little bit harder to have some of the things that, you know, causing more trouble as far as the TikTok, the Instagrams, the Facebooks, and things like that.
It's so hard for parents and
Really
the social
difficult.
pressure, peer pressure that you mentioned before. What do you think about having like a Surgeon General's warning like we have on medicine and toys and cigarettes?
Yeah, you know, I think it's a good idea. I mean, if as a parent, if we thought that, you know, cigarettes were out there and like, you know, 8-year-olds could use them, I think we'd all be like, oh my God, that's kind of insane. Or if we dropped the drinking age to 8, people would be like, that's outrageous. I think we have to think about social media a little bit like that. There are a lot of things that are great about social media. It's not all bad, but there's enough risk with it where it probably needs some level of oversight, restriction, especially for our children who are vulnerable.
And this is just beginning. We're going to be dealing with this for quite some time.
I think we're going to talk about this for a long time.
Doctor, thanks for being with us today.
You bet.
Great
Thanks.
to see you, Jeff. Thanks.
Yeah.